Come learn with us. Welcome to our channel Learners. Today we are going to learn about Raynaud syndrome. The condition known as Raynaud syndrome, which is pronounced as Raynaud's, affects the tiny blood vessels in your fingers and toes. Blood vessels in your lips, nose and earlobes may also be impacted. The capillaries and arterioles in your fingers and toes tighten more than they should when you have Raynaud's attack. The skin in affected area may become white, eventually blue as a result. Your blood's lack of oxygen causes this color shift and your skin may feel numb or cold. The average duration of this attack is 15 minutes. There are two types of Raynaud's attack, which is primary Raynaud syndrome and secondary Raynaud syndrome. Primary Raynaud syndrome does not occur in any conjunction with any other illness or condition, but secondary Raynaud syndrome can be brought by a medicine, lifestyle, choice, or by any underlying medical condition. Primary Raynaud syndrome does not harm your blood vessels. It is not a serious condition, but it could interfere with some of your everyday routine. Most severe cases of secondary Raynaud syndrome are possible. Skin ulcers and rare cases, tissue, death, gangrene could result from it. Who is affected by Raynaud syndrome? At birth, people who are allocated to the female gender can be affected, and individuals under 30 frequently begin in their teens can be affected. And approximately 90% of the individuals with scleroderma and affects roughly 1 in 3 of lupus patients, and more common in those with autoimmune diseases. So who are using vibrator machines and more using of jackhammers are susceptible to Raynaud syndrome. What are the effects of Raynaud's illness? Usually your skin may be affected by Raynaud syndrome, which can include color shifts. Your skin may transit from white to blue or red when blood flow pauses and then resumes. Feeling numb or cold. This occurs when blood that is rich in oxygen is not getting to your finger or affected body part. The area of your body seems to have gone asleep. Warmth, tingling, or any pulsating sensation. And some of the skin changes include gangrene with skin ulcers. Like your fingertips may develop painful sores as a result of longer or more frequent episodes. So what are the causes of Raynaud syndrome? As I told you before, primary Raynaud syndrome has no unknown underlying cause, but secondary Raynaud syndrome is often caused by some of the diseases like cancer, carpal tunnel syndrome, hypothyroidism, lupus, polymyositis, pulmonary hypertension, rheumatoid arthritis, and vasculitis. How is Raynaud syndrome diagnosed? Usually the Raynaud syndrome is diagnosed by your healthcare experts based on your symptoms. And some of the common tests that are used, diagnostic tests that can identify your Raynaud syndrome, is nail fold capilloscopy. It is a particularly helpful test. For this test, your physician applies a drop of oil on your skin near the base of your fingernail. If your capillaries in the area are swollen or aberrant, you could have a connective tissue disorder. This might indicate that you're having secondary Raynaud syndrome. Other tests that your doctor may prescribe include ANA, which is anti-nuclear antibody test, a blood test that detects autoimmune disorders, and CBC, complete blood count, is a blood test that looks for a variety of disorders. ESR, erythrocyte sedimentation rate, a blood test that measures inflammation in the body and aids in the diagnosis of rheumatoid arthritis and other immune diseases. Rheumatoid factor, a blood test that detects autoimmune disorders. And some of the treatment you have to take while having Raynaud syndrome is avoiding cold environments such as frozen food aisle, or severe air conditioning. Avoid touching cold objects, manage tension and intense emotion that could lead to an attack. Wear warm clothing in frigid conditions. Your clinician may prescribe one or more of the drugs like calcium channel blockers. These medications assist your tiniest blood vessels relax and open. As a result, you experience fewer attacks, and those that do occur are less severe. Calcium channel blockers can also help heal skin sores on your fingers and toes. Second one is alpha blockers. The medications blocks norepinephrine, that is a hormone that constricts your blood vessels. If you have severe Raynaud's disease and conventional treatment fails, your doctor may consider a sympathectomy. A sympathectomy temporarily inhibits or cut small nerves near the afflicted blood vessels. How to manage Raynaud's attack? If an attack occurs, be proactive. Do not overlook a Raynaud's attack or think it will go away on its own. Taking the right steps can help to shorten and weaken the attack. You have to move immediately to a warmer environment, massage the affected region. Run warm, not hot water over your fingers and toes. If stress is what caused your attack, meditate or do deep breathing exercise. You have to contact your provider if you have attacks on one side of the body or having sores or ulcers on your fingers and toes.